Thank you, Komal, for that lovely introduction. Thank you, all of you, for being there. This topic is very close to my heart, and the reason for that is that I'm seeing patients every single day nowadays with breast cancer. I can't say every single day, but at least every alternate day, it has become that common. And the beauty of it is that it is actually preventable. And so we can all do something right now so that none of us ever suffer from this. And if we are suffering from this, we can still take charge of our health so that we can prevent recurrences and get out of the whole problem. And I'm going to share with you whatever I've learned through treating patients over the years with breast cancer. So let me share my screen. Sorry. Oh,
Visible, doctor.
thank you. So Komal already told you that SHARAN stands for Sanctuary for Health and Reconnection to Animals in Nature. And I truly believe that if we live in accordance with nature's laws, it's easy to be well. So how can we live free of breast cancer? And before I start, I just want to share with you that October is Breast Cancer Awareness Month. That too, just because it's become so common these days. Actually, breast cancer is the number one cause of cancer in women these days. Now, this is a video of Nisha Koiri, who suffered from breast cancer in 2016. She took a consultation with SHARAN, and this is, I think, a year later, where she talks about how she didn't go for any other treatment, but only went for lifestyle changes and reversed her cancer, which doctors said she had only months to live. So let me play this video. I was advised immediate surgery, full mastectomy therapy, and radiation. But on researching, I came to know that chemotherapy is highly, highly toxic for the body. In fact, it causes cancer because it cannot kill the cancer stem cells and it does cause cancer. Radiation is again very, very bad. So I was looking for a solution which will let food be my medicine. And thank God, in the very same month of May, I could find SHARAN. And through SHARAN's diet, I'm also doing naturopathy and homeopathy, but that came much later. Naturopathy was at the beginning. But my main is the food is my medicine, and I'm following it very, very nicely, very strictly, and very lovingly actually, enjoying every day, every meal, loving my life. And thank God I have not visited any oncologist. Wow. And lumps in the breast have now reduced by half. I'm working, I go to the gym. If I tell people that I was diagnosed with cancer, nobody believes it because looking at me, of course, nobody can come to know. I was given only 45 days to live. So this was a year back, and it's in May, that is. More than a year now, and I'm happily living my life. No, they said that's the cancer, you get a death sentence. Basically, with all cancer doctors, they'll give you a death sentence. If you don't do the surgery, I said, do I have 6 months? They said, no, 3 months. Imagine this woman who was so brave, and the reason she was brave is because she understood nature's laws of healing, which we are going to talk about today. And so she avoided going for any treatment. This is an email from her in 2018. That means exactly 2 years later, she's written, Good morning, Dr. Nandita Shah. I just realized today was the day 2 years back when I was diagnosed and was given only 45 days to live. If not doing any kind of surgery, chemo, and radiation. With God's blessings, 2 years are up. I want to tell you that this is another email a year later, but she's still alive today. She's still doing very well, and she's helping people um, stay well. Like she was one of the people who campaigned against the COVID vaccines because of the danger to health of the COVID vaccines. And she's made videos about how she helped herself get well from breast cancer. Now, this is another woman, Dr. Lorraine Day, this time a doctor, an orthopedic surgeon, and it was her video that really inspired me to treat more people with cancer because it's very rare that a doctor, an allopathic doctor, understands the plan of nature. Uh, Komal, you're still hearing me well, right? Everything's good, right?
Yes, doctor.
Okay, great. I understood the plan of nature, and Dr. Lorraine Day, when she was diagnosed with cancer, and she had been doing a radio show on cancer at the time when she was diagnosed. So she had interviewed people from all over the country of US who had treated themselves from cancer and got well. And she when she was diagnosed with cancer, decided to treat herself as well and not rely on the medical community, even though she was a doctor. She said, I didn't get my breast removed because the cause of the cancer was not that I had too many breasts. That means what she understood is that if we want to get rid of cancer, we have to remove the cause of the cancer. We can't just remove the cancer cells, which is what chemotherapy, radiation, and surgery do. They just remove the cancer cells. And I do want to say here that I'm not against chemotherapy, radiation, or surgery because I've seen patients heal with the help of that treatment, and I've seen patients heal without that treatment. The main thing that we need to do if we want to heal is understand the cause of cancer. I'll be telling you what exactly chemotherapy does and radiotherapy does. And I believe that it's always a choice, and the choice might even depend on how fast the cancer is growing or how fearful we are or what is our understanding at that point. And it doesn't matter what our understanding is or what we believe, we can get well with chemo or without chemo if we start removing the causes of cancer. And this is what we are going to discuss. So, what is cancer? If you see this diagram, the upper part of the diagram shows the normal cell division. That means a cell multiplies into two, but then one of those two cells is destroyed so that the number of cells in any tissue of the body remains the same. But in cancer, there's an exponential multiplication that one cell becomes two, and two becomes four, and four becomes 16. It's an uncontrolled growth. And because it's an exponential growth, from a very small bit of cancer, you can have a huge tumor in a short period of time depending on how what the rate of growth of that cancer is. And what our goal should be is to race against that cancer. But before I come there, I just want to say that all of us here have cancer cells in our body right now. The beauty of our body is that it's able to keep these cancer cells in check. But sometimes we create those conditions where normal cells don't thrive and cancer cells can easily survive. If we understand those conditions and remove them, we can actually prevent cancer. And this is not just breast cancer. Today we'll be talking more about breast cancer, but this is all forms of cancer. So, what are the signs and symptoms of breast cancer? How can we diagnose this cancer early? A lump in the breast, or a thickened area of skin in the breast, or a nipple that looks flattened or turned inwards, or has a different shape, changes in the color of the breast skin, changes in the size, shape, and appearance of the breast, changes in the skin over the breast, like it looks dimple like an orange peel, or peeling, scaling, crusting, flaking of the skin on the breast. Also, pain in the breast or pain in the axilla, in the underarms, where the lymph nodes connected to the breast are. And there are several types of breast cancer, but the most common ones are the invasive ductal carcinoma, which happens, when the changes occur in the uh, milk ducts, and invasive lobular carcinoma, which occurs in the milk glands or lobules. Now, there are other kinds of less common breast cancers as well. And today we're not going to talk too much about what kind of breast cancer it is, but what can we do to prevent and reverse it. So, one of the first things to do is breast cancer detection. And one of the ways that we can do it is self-examination. Like just look into the mirror every time or often after a bath, see if anything looks different. Feel the breast tissue and see if anything feels different regularly. And then, of course, mammography. And I have to tell you the truth, I'm not in favor of mammography at all, for the simple reason that where people have mammography done every year, it means that you're exposing yourself to x-rays every year, and you're also exposing yourself to breast injury because the breasts are pressed hard on. So I don't think that that's something very good. And also I feel that if we keep checking for cancer, it keeps the fear of cancer in us all the time. So let's do something a little more relaxed. And just for the record, instead of mammography, now we can do thermography, which just checks the thermal level of the breast tissue. And if the heat is more, that means the cells are more active, it means that it could be more likely to be breast cancer. There are few places that do thermography now for cancer detection in India as well. There's this movie called The Breast Kept Secret, which talks about how harmful mammography is and how thermography can be a better solution for this. I'm sorry about that. Just give me a minute. Yeah. Um, So, the risk factors for breast cancer, let's look at them. And these are things, the first set of risk factors are things that we can't do anything about. One is sex. That means women are more prone to breast cancer than men. Truly, that does not mean that men do not suffer from breast cancer. They do. And today we have a lot of men suffering from gynecomastia. Women like breasts in men, and this is largely caused by the influx of hormones in our food. So it doesn't happen only to women, it can happen to men as well. It is more likely to occur at an older age. Certain family histories are also known, like certain DNA changes that are in the family. The most well known ones are BRCA1 and BRCA2, past history of breast cancer, early menarche. And this is happening so often these days. And this is something that we can definitely avoid: premature puberty. We are going to talk about the causes of premature puberty soon when we talk about the hormonal causes of breast cancer. And then late menopause. Again, this is because of hormones in our life. And late pregnancy or no pregnancy is also a risk factor. Obesity is a risk factor. Tight clothing and lack of circulation to the breast is a risk factor. So, as I said, logical cancer prevention and reversal means removing all the common causes of cancers, understanding the causes of cancer and removing them. The number one cause of cancer, I believe, today is excess proteins. Now, this is something very hard to believe, and yet, if you read the literature, it has been found that as we have increased in our protein consumption, because today we have more dairy than we ever had before, we have more non vegetarian food than we ever had before. Remember that without refrigeration, the amount of dairy that we can consume is very minimal. Cheese and paneer, which have become household items today, were rare when I was a child. That means just in my lifetime. And so were cancers and breast cancer. To the extent that when I was studying in college to be a doctor, we were taken to the cancer hospital, Tata Memorial in Mumbai, for terms so that we could learn about cancer, so that we would be able to understand it in our patients. And the doctor who was teaching us over there said that you should not concentrate on cancers because cancers are relatively rare in India. The more common diseases are malnutrition and starvation, and we should work at how we can heal our population of these. But actually, even though the number of people suffering from starvation and malnutrition hasn't improved a lot, the number of people suffering from cancer has just multiplied. And this is because of excess proteins. And we're going to talk about this in a much larger context. But just to start off, let us talk about where these excess proteins come from. Proteins are the food for growth and repair. Cancer is a growth. If we take excess food for growth, we are going to end up with growths. And most people think that protein comes from animal products. But the truth is far from that. Protein is only produced by plants. And animals have protein only because they ate plants. But now we are told to have concentrated forms of protein, like paneer, for example. Imagine paneer. Protein is the food for growth. Cow's milk is the food for a calf to grow to full size in just 18 months. And we concentrate that 12 times to make paneer, as if we would ever need a concentrated form of cow's milk when even cow's milk is too concentrated for us in terms of protein. Let me explain. If you had to give cow's milk to an infant, you have to dilute it 3 times because it's too much protein for an infant. But now we're taking concentrated forms of cow's milk in the form of paneer and cheese, and And then on top of that, now Diwali is coming in milk sweets and, of course, other animal products. Now, as I said, plants are the only producers of protein in the world. And they produce protein with the help of water and air and nitrogen from the soil and other nutrients as well. And if we consume plants, because our natural food is plants, I mean, instinctively, we are attracted to plants. Plants are the only foods that we can eat raw. If we would, and all the animals eat their food raw, right? And so if we were to eat only plants, we would get all the proteins that we need. In fact, if we were to eat only fruit, we can get all the protein that we need. But greens have more protein than fruits. Green leaves, I mean, beans have more protein, sprouts have more protein, all seeds and grains have more protein. That means it's really hard to be deficient of protein, but excess protein has become a norm these days. You go to the gym and you want to build muscle, and the gym instructor tells you to have more protein, and people are eating several eggs a day. This is scary. Before we go there, so I just want to say one more thing about proteins, that if we eat plant proteins, we can never overeat proteins, especially whole plant proteins, because the fiber prevents us from overeating. But if we eat animal proteins, because of the lack of fiber, we can easily overeat. Like, you may have found that you're feeling full after eating too much paneer, or too much cheese, or too much eggs or milk. But it's very rare that you have overeaten dal and you feel uncomfortable. And that's just because the fiber helps us not overeat it. So it's really important to have plant proteins and whole. We do need proteins, but we don't need the excess proteins cause disease. The second big cause is excess fat. Now here you see a blood sample which has been centrifuged, and you see the red blood cells at the bottom and the plasma on top. This is normal blood, and this flows through our arteries well. But if we have eaten a fatty meal, the blood looks like this. And unfortunately, today, most of our blood is looking like this, which is why we usually get a blood test done 10 hours or 12 hours after a meal to allow the fat to get out of the bloodstream. When this thickened blood goes through the arteries, it doesn't flow easily, which means that the blood may not flow well through the tinier arteries or the capillaries, and this may lead to less blood supply in parts of the body. Now, less blood supply means less food as well as less oxygen. Normal cells don't survive well with less oxygen, but cancer cells can survive. So when we eat fatty foods and make our blood thick, we are inviting cancer cells because normal cells can't survive. Actually, over a period of time, our arteries get narrower and narrower just because of the thickened blood which injures the artery walls. The artery walls are bandaged with cholesterol, and over a period of time, the the arteries become narrow. Now, that's not too bad because the body always produces a collateral circulation. When one artery is closing up, it's like branches of a tree, more branches are formed. But if the plaque breaks off from an artery and blocks an artery, then there can be a shortage of blood supply. And this could lead to angina, it could lead to stroke, but it can also lead to cancer. So, fat is one of the major causes of all diseases. And here you can see the changes in the arteries over time. And here you can see that the animal fat intake and breast cancer correlation. Those countries with the highest consumption of animal products are also the countries with the highest rates of breast cancer. We often think that in India we don't have a lot of animal products, but that's because we forget that dairy is an animal product. And today in India, we have a very high consumption of dairy products in the form of curds and cheese and paneer and milk sweets and butter, ghee, even if we're not taking milk per se. So, the foods that we need to avoid, foods rich in fat, are all animal products and all free fats like oil, ghee, and butter, and all animal products, including milk. Imagine any animal product like fish or meat or chicken or milk. Boil them, you get fat on top. Now, plants, it's a little different. If you boil peanuts or sesame or coconut or uh, cashews or almonds, you don't get fat on top because the fiber holds on to the fat. So, here again, only plants contain fiber, and the fiber holds on to the fat and doesn't allow it into the bloodstream. So, fiber actually protects us from overeating proteins as well as overeating fats if we eat whole foods. That's why we don't even want to have a lot of oil because oil has no fiber, right? Oil is an extraction of something that has fiber but throwing out the fiber. So, lack of fiber is a big cause, and therefore, we want to have foods. In this image, you see foods which are whole pasta and whole bread and everything as whole as possible, potatoes with the skin on. If we can eat foods whole, we will increase our fiber intake, make our blood thinner, and improve the oxygenation to every part of the body and prevent breast cancer or any cancer for that matter. Now, another big cause is hormones. And hormones, the hormones, sex hormones, especially in breast cancer, the hormones come from all animal products because the animals produce the same hormones that we do. And milk and dairy is especially high in estrogen, progesterone, and growth hormones that are hormones that promote cancers. And sadly, often doctors don't tell us that we should stop putting these hormones in our body. We should just stop consuming animal products if we have a hormone dependent cancer like breast, ovarian, or prostate cancer. So, foods is a big one through which hormones enter our body every day, which is why we have so many hormonal problems these days. Like we have hypothyroidism and PCOD and early puberty and menstrual problems and menopausal problems and of course gynecomastia and then breast, prostate and ovarian cancers as well. Now, hormones can also enter our body through medications. It could be hormonal medications for nowadays, infertility is so common, and people are taking fertility treatments in the form of hormonal medications or, due to IVF, and also oral contraceptives are hormonal medications, and then hormone replacement therapy is also hormonal medications, and steroids are hormonal medications, and so on. And then, of course, the fertility treatments themselves can cause these kind of problems. Now, dairy is another big one. I already told you that dairy contains the female hormones, estrogen, progesterone, but it also contains powerful growth hormones to make a baby calf grow to full size in 18 months. Remember, we don't need those kind of growth hormones because our rate of growth is much slower. We grow to full size in 18 years, hopefully. And dairy also contains IGF-1 or insulin like growth factor 1, which not only promotes diabetes but can also, um, it is also a known cancer promoter. And then dairy contains a milk protein casein, which has also been found to promote cancerous tumors in rats and probably humans. And by cutting out dairy, you can actually shrink these tumors. So that's what Nisha Koiri did. The video that I showed you right in the beginning, she immediately changed her diet and started getting better. So the hormones in dairy can promote hormone-dependent cancers. I told you breast, ovarian, and prostate cancers. And hormone-dependent breast cancers are ER, PR, and HER2 positive cancers. You must have heard of those, right? Then the other thing that can invite cancer cells is an acid environment. Normal cells require an alkaline environment, but cancer cells can survive in a more acidic environment. What are the things that promote an acidic environment in our body? Just for the record, the most alkaline food in the world is fruit, all fruits, even sour fruits, citrus. I was just talking about an acid environment that normal cells survive best in an alkaline environment, and fruits are the most alkaline, but all fruits and vegetables are alkaline in our body. And so we should eat more fruits and vegetables. Of course, we should also cover all the colors of the rainbow with different phytonutrients to help fight disease. And the common acidic foods are all the animal products because the animal products, they contain a lot of protein and it breaks down into amino acids, which are acid yielding in our body, as well as um, plant products like sugar, coffee, tea, wine, alcohol, vinegar, salt, and colas. All of these are highly acidic. And that's why it's so essential to think about reducing or cutting out tea and coffee and alcohol. All the addictive things are acidic. Now, other cancer causing foods are also sugar is a big one, processed meats, cooked meats. Of course, meat you cannot eat without cooking, but when you cook meat, it has heterocyclic amines, which are carcinogens. And carbohydrates, also cooked at high temperatures, contain acrylamides, which are carcinogens. That's why if we want to heal cancer, we should go to cooking at lower temperatures, less cooked food, and ideally raw food. And then chemicals we know are carcinogens. That means that we should avoid the chemicals in the food, the packaged food, the processed food, as well as the non-organic food. This is so important, and I recognize that so many people don't realize how harmful the pesticides in the food are. And just to give you an idea of how harmful it is, there's a train that goes from the Punjab to Bikaner, where a big cancer hospital is, every single day, and it's called the Cancer Express because it carries patients with cancer from Punjab, where they use lots of pesticides, to the hospital in Bikaner. Let's try to avoid all this by eating more organic as far as possible. It's just not worth putting these chemicals, which even animals will avoid if they can into our bodies. And then the personal care products. All of these are chemicals, the soaps, the shampoos, the perfumes, the deodorants, the toothpaste, the mouthwash, all of these. And just because they're sold in beautiful containers, we often think that they're innocuous. But perfume is one of the most harmful hormone disruptor that there is, and the most harmful carcinogen. So, and unfortunately, everything, even the soaps contain perfumes, or the air fresheners, uh, the scented candles. We should just minimize all of these things. I've often sat in cars and found that, people put scent in cars and then turn on the air conditioner. So you're breathing that stuff all the time. Please avoid these. These are easy to avoid. And we can't forget that medicines are also chemicals. I mean, our body produces disease in order to tell us that we are doing something wrong. And we often take medicines for that disease. Like, for example, many of the patients who get cancer have diabetes and they've taken medicine for diabetes, and then they get high blood pressure and they take medicine for that. And the causes of cancer and the causes of high blood pressure and diabetes, the main causes are similar: excess fat and lack of fiber. And so, they take medicine for that, and it's the body's duty to keep telling us that we are doing something wrong. And so the body produces yet another set of symptoms, which is cancer. So if we can heal any disease without the use of medicines, that is a bonus because we're preventing cancer in the future. And then home care products, the phenyls and all the strong smelling window cleaners, toilet cleaners, sprays that we're using everywhere are harmful to the environment, but they're harmful back to us as well. And so we should avoid them. And the plastic containers, the bottled water, the non-stick cookware, the alcohol. Let us avoid these simple things in our kitchen as well. And then pollution. I mean, I live in a village, and because there's so much garbage around, it's just multiplying. They don't have anywhere to put it, and they're burning it, and we're breathing that, and it's going into our water supply. And even if you're away from it, it might be happening that it's coming back to you, or you're living in polluted cities as well. And we need to do whatever we can to prevent this pollution from growing because it causes cancer. Electromagnetic frequencies, the 5G, the 4G, the remotes, all of these things, the laptops and the computers and the Bluetooth and the mobile phones, let us use them only when we need them and turn off those modems at night. I can't stress on stress more. And in the case of cancer, it's usually anger and resentment. Stress and emotions that can't be expressed, that are kept inside and eat us up from inside the way cancer does. This is why it's so important to let go and to forgive. And lack of sleep. The body heals during sleep. I can't stress this more. Sleep is so very important, and the sleep at the right time. That means going to bed when it goes dark in the night and getting up without an alarm and without stress. The more you sleep, the faster you heal from anything, including cancer. That's why when we're sick, we feel tired, so that we stop being active, and go to sleep. Let us not take medicines to remove symptoms and keep activity going. Now, breast cancer can spread to other parts of the body, and this is known as metastasis. It can spread from the breast to the nearby lymph nodes, and then it can also spread to the liver, the lungs, the bones, distant lymph nodes, and the brain. And that's why thermography is also good because it can check the hot spots all over the body. So is an MRI, but of course, that's radiation. So there's a limit to how frequently we can do it. Now, will the breast cancer be curable? And I want to say that, any cancer is curable if we really put all our effort into it and remove the cause. But sometimes we get bogged up in fear. And I can understand this because, you know, cancer is scary. It has such a bad reputation. And therefore, let us really understand how it is cured. Today, there's more treatment than ever before. And, we just have to make up our mind to allow it to cure. I've treated patients without any treatment, people who couldn't even afford treatment, who we could hold the tumor just as it was for years and years. And I've treated elderly people like this, like people who didn't want to go in for any treatment because of their age, and the cancer was stable just by lifestyle changes, not allowing the cancer to grow. So, what are the factors? Age is one, but it's not the most important. Type of cancer, yes, it is. If it's a fast growing cancer, then we should consider chemotherapy or radiation because we're in a race against the cells. So, if we can kill the cells and then while we're doing that, remove all the causes, we will be ahead. The duration, of course, we should start thinking about it even before it happens. But if it has already happened, we should start, working on it as soon as possible by removing the cause. Sometimes people think that, okay, let me finish my chemotherapy and then I'll start doing all the natural treatments. That's not a good idea. Actually, if you start changing your diet during the treatment of chemotherapy, you suffer way less from the side effects of chemo. So all of these are important, and of course the compliance of the patient. And I'm not saying it's easy because most of us are used to eating cooked food. And imagine the fastest way to heal cancer is 100% raw food, but not everyone can joyously go there. So at least let's start eating more raw food and cultivating a taste for high quality raw food now so that we don't get cancer in the future. And of course, the life situation. I mean, there are people who need to work at night, or there are people who have, difficult situations which cause lack of forgiveness and resentment. But most important is, do we have the will to get well? Like, do I want to live? Because I've seen patients who don't get through cancer just because their life situation is so bad that they don't even want to live anymore. So we have to have the will to live if we want to get cured. That's the most important. Now, the conventional treatment for cancer is surgery, chemotherapy, and radiation. If the tumor is very small, it's first surgery, just remove the tumor. That's what the allopaths think. But if the tumor is wider, spread, then chemotherapy would be first to kill all the cancer cells so that then it's confined to a small space and the organ or the lump can be removed if it's still there. And radiation means just burning the cancer cells. Now, none of these are absolute, because just because you remove the cancer, if you don't remove the cause, it doesn't help. In fact, Dr. Lorraine Day didn't do surgery at all, because she said that if I do surgery, if I remove the tumor, how do I track my progress? How do I know that I'm doing the right things? Because if the tumor is shrinking, it means I'm doing the right things. And I've seen patients do it this way and get well. Nisha Koiri was one of them, but I've seen other patients as well. Now, chemotherapy is a bit scary because it goes through the entire body, and it kills all the fast growing cells, and so it can produce symptoms almost everywhere. But I do want to say that if we are on a high quality plant based diet, the side effects of chemotherapy can be minimized. And nowadays there's targeted therapy which blocks the cancer cells from reproducing themselves. And so it can be less harmful, even though there are equal side effects with that as well. So, how do we minimize the side effects of chemotherapy if we have decided to go in for chemotherapy? One, have a purpose. Like, I want to live for, and I saw, in the book Chris Beat Cancer, Chris wanted to get married and have children. And so he was determined to heal his cancer because of his purpose. And he did it. Also, we can minimize the side effects of chemotherapy with high quality foods. That means everything should be organic, as raw as possible, all the colors of the rainbow every single day. Rest as much as you can. Exercise if able. Like, we should always keep moving, and if you can't do any exercise, pranayam is worth doing, because increasing the oxygenation creates the conditions for normal cells to survive and cancer cells to thrive less. So, pranayam, and then minimize stress. Meditation would be great, and laughter therapy would be fabulous. That means just watch movies that make you laugh and get your mind off the cancer or the fear, and do the right things in order to get well. As I told you, radiotherapy is burning, and so radiotherapy also produces all the side effects of burns, like dryness, soreness, blisters, discoloration, swelling and edema, pain, hair loss, tiredness and fatigue, weakening of the bones, and damage to the nerves. And then there's also a medical prevention in people with high risk, like people who've had cancer of the breast. They may be given estrogen blocking medicines like tamoxifen and letrozole, etc., Femara. Um, or they might even be given a prophylactic mastectomy. Truly, I think that these may not be required. They have their own side effects, and that it would be much better to stop putting estrogen in your body. Stop consuming animal products which contain estrogen. Just change the diet to a high quality diet, and give your body the opportunity to heal, rather than the need to throw out chemicals that we are constantly putting in. So there are lots of alternative therapies, and many of them are good, but the most important ones are the ones that bring back balance in our body, bring back energy in our body, and and help us do what nature expected us to do. I would highly recommend working on the mind and working on the nutrition. Now, why should we change our lifestyle right now, especially before cancer occurs? Because it is so common these days, right? And it's so preventable as well. So, what should we do? We should eat only plants, really cut out all the animal products, eat only whole foods as far as possible, eat organic always if possible, eat more raw or 100% raw if possible. Have all the colors of the rainbow every day, considering high quality foods to be the spare parts for healing. And keep an open mind so that if chemotherapy is required, we do it. If it's not required, we keep watching our progress and trying to heal without it. Have all the colors of the rainbow through salads every day. You can even have vegetable juices to put, not fruit juices, by the way, the sugar is too much, but vegetable juices to put a lot of nutrients in your body as healing components in a short time in an easily digestible way. And avoid eating foods that are junk in favor of raw and colorful foods. Check and supplement vitamins B12 and D. They are known to be low. If anything else is low, it can also be checked, and you can take foods that will give you that nutrient. Sharan has a 5 point plan that everything should be plant based, whole, organic. Vitamin B12 and D should be checked and supplemented. I just want to leave you with some references for breast cancer and other cancers. Dr. Lorraine Day has written a book, Cancer Doesn't Scare Me Anymore, and she also has several videos. A lot of people think that Dr. Lorraine Day is phony, but I know that it's true what she says because I've seen that in my patients as well. Please, this is really important, and the medical community can cut down all this information, but this information can never harm. So she has an acronym, New Start AB, for the different things that you should do, which anyway can never harm. Nutrition, we talked about that, exercise, water, sunshine. Water, we need to cleanse all those things out of our body, medicines or cancer cells, sunshine, temperance, which means avoid addictive substances, fresh air, rest at the right time, trust in God or your body that it knows how to heal, and an attitude of gratitude for what we do have, the knowledge to heal, and the and benevolence. Like, the more you teach, the more you take care of yourself. And that's what Nisha Koiri did. When she got cured of cancer, she worked and still works hard to help people prevent disease through vaccinations or other wrong treatments. I'm not saying that all vaccinations are wrong, but definitely they are overused right now. Chris has written a beautiful book, Chris Beat Cancer. Definitely worth reading, going to his website. As I told you, he wasn't married when he got cancer. He was young. He wanted to have a family, and he does now. And his daughters are even grown up. Louise Hay got cancer, and Louise Hay was teaching people how they can heal their life through healing their mind. And she healed herself in the same way without treatment. So her books are really worth reading. Chris Carr did not have breast cancer, but she had another great stage 4 cancer that she has managed to live with without using any medical treatment for years and years, and has helped so many people heal. This is another good book. Cancer is not a disease, it's a survival mechanism. The body is always working to heal. And so, if we understand why the body is producing cancer, we can heal it. This is a book by Professor Jane Plant, who got breast cancer and realized through her study that the Chinese didn't suffer from breast cancer the way people in the West did, because they don't consume dairy, they're not pumping hormones into their body. We can stop doing that right now. So, steps for prevention and reversal: remove the fear. SHARAN's 5-point plan for nutrition, Dr. Day's 10-point lifestyle plan, minimize chemicals, work on stress and your emotions, and remember that disease is a path to personal growth. That means that when we get a disease, we should say thank you to the universe for showing us that we're doing something wrong. It gives us an opportunity to change and heal. And a few final thoughts before I end. And I know that I've gone over time, but this is going to take just 5 minutes. Uh, the definition of cancer is an unregulated overgrowth of undifferentiated cells, ultimately harming and destroying the very organism in which it grows. The cancer cells destroy our body. Well, when we have cancer in us, the number of cases of cancer have increased these days is also because we are creating cancer in the world around us. We are growing food undifferentiated, acres and acres of the same crop. This is not according to nature's laws, where there should be a differentiation. We are polluting our environment with plastic and chemicals, and we are getting polluted inside as well. We are raising animals with horrific stress to the animals. And this stress, because we experience stress through hormones, they experience stress through hormones. We are taking in their stress hormones all the time and creating our cancer. And we have to remember that we are raising animals for food. 80 billion land animals are slaughtered every year for food to feed our 8 billion, and they are undergoing stress and polluting the environment, and we are decreasing the biodiversity, which is back to the cancer cells, which are one undifferentiated multiplication. Right now, humans are multiplying, and the animals that we eat and the crops that we eat are multiplying, but this is a cancer to our planet. And we can't save ourselves from cancer unless we save the planet. So, reversing disease requires a shift in consciousness, a shift in culture. And we can all do this together so that in the future, people suffer less from cancer, not more. And SHARAN can help you in a number of ways. We have events to support you in making these lifestyle changes. We have consultations and a team of doctors, nutritionists, as well as counselors. We have cooking classes that teach you how to cook in this way. And we even have a raw food section in the recipes section of our website so that you can make fabulous raw food. We have a whole section for salads. We have retreats to handhold you through this process so that when the retreat finishes, you can stay on the path. And we have a new published a new book called Meal Replacer Salads, which are not 100% raw, but they are largely raw, so that we can all learn to eat more raw from today and not suffer from cancer. So that's it from me today. I would have loved to show you around our website, but I'm going to leave it because we have run out of time and I would like to answer a few questions.